Next slide, please. Let's go briefly into the anatomy of the gums itself. Next slide, please. And the next slide kind of shows you anatomy of what healthy gum looks like. You know, you've got the gums going in between the teeth, the interdental spaces, and it's nice and pink and not bleeding. Next slide, please. And just a rough, the anatomy itself, like we said, what we talk about, the structure of the gum itself is the fancy word, is what we call the periodontium. And basically it includes the gum over the teeth. If you look at the other, the diagram of the tooth split into two, you've got the bone and you've got the tooth. And then you've got these fibers that attach the bone to the teeth. And that kind of acts like shock absorber mechanism. And that's why if the teeth were directly connected to bone, every time your teeth hit together, they would shatter and break. And the periodontal ligaments acts as, like I said, the shock absorber mechanism that takes the bulk of the stuff. And that's why if you grab hold of your tooth, there's a slight degree of movement. If you hold a tooth and you try and move it, you feel it move slightly. And that's the effect of that. Next slide, please. Okay, so overall, you know, like I say, gum disease is an infection of the tissues that hold the teeth in place. And that's, so it's anything that would affect the gum, the fibers that hold the tooth to bone, the blood supply, and it's basically caused by poor oral hygiene and brushing habits, you know, and what happens is a lot of the stuff builds up on the teeth, and that causes an irritation. Next slide, please.
Ooh.
And this is just a rough idea of, you know, once you've got you have I'll explain this. You have the biofilm, right, which is just saliva and all the enzymes and the bacteria and all that wash over our teeth, right? If you wake up first thing in the morning and you take your finger and just rub it on your teeth, right? You get this, and you look at it, you get this white stuff, which is the plaque. That is what when we brush our teeth every morning, that is what we're trying to get off. Because if that is not brushed properly, that hardens, it calcifies, and you get the hard stuff on your teeth, which is what we call calculus. Next slide, please. Right, so this is just a preamble. So basically, we've got bacteria in our mouth. You know, it's a natural, I think they said we've got over 300 different types of bacteria in our mouth. And the idea of, like I said, the bacteria is there. And when it's there at the appropriate level, it keeps our mouth healthy and all. And it's when we don't brush this stuff off our teeth that it hardens, and it now causes gum disease. Because what happens is the bacteria, when the stuff is not brushed up, it hardens, and what happens is you get bacteria now form, you know, it now hides and presents a lovely covering that hides even more aggressive bacteria underneath, more harmful bacteria basically, which actually now go in and do the damage. So when you brush over the hard stuff, but the calculus, but the bacteria is nicely protected under that, and that goes on and does the damage. It starts off with an inflammation. That's where you get the reddening and the bleeding, right? And what your body does is an immune response is triggered. There's increased blood supply to the area, right? Because, and what your body is trying to do is to bring all the cells that would cause, that would bring in repair and repair the stuff. But what happens is, because the bacteria is protected by the calculus there, it actually results in more damage. And what happens is the ligaments are broken down and the tooth becomes more mobile and more damage is done. There are risk factors. We talked about the risk factors. Diabetes is a risk factor. And there's someone I was treating who who were having problems, getting his gum disease under control. I'm now sent him to have a blood test. And what happened was, now discovered he was diabetic, which was why he wasn't responding to treatment. And it's just the same, like the medics amongst us, just like it's the same mechanism that happens with the leg ulcers that doesn't heal. It's the same thing that's happening in the mouth as well with in the periodontal. So there are hormonal changes, there's obesity, conditions like HIV, leukemia, risk factors, poor nutrition, poor health. If for any reason we're on medication that reduces the saliva in our mouth, there's also some medication that we eat and drink that we eat and take that can actually cause this. Next slide, please. Next slide. Thank you. So like I said, there's a direct link between heart disease and gum disease. People who have heart disease, who have gum disease, and they said there's the bacteria in the mouth that's carried to the heart and does direct damage to the heart tissue and stuff. Next slide, please. And usually in simple form, it's kind of staged in 3. Like I said, there's gum disease can be divided into gingivitis or periodontitis. Gingivitis is just an inflammation of the gum, and once that is sorted out, the gum, there's no permanent damage done to the tissues of the gum. Once you go into the next stage, which is periodontitis, then you now have permanent damage. In the first stage, you get mild inflammation and bone, you lose about a third, say you lose a bit of the, a third of the bone. And the moderate stage, you lose about half the bone that's holding the teeth in place. And in the advanced stage, advanced periodontitis, you've lost about 2/3 of the bone and you're just left with about a third holding your teeth in place. Next slide, please. And like I said, it starts off with an inflammation, which is known as gingivitis. This is reversible. Brushing and flossing your teeth will get rid of that. But if the debris is left to build up, it forms the hard plaque and now causes further permanent damage. Next slide, please. And once it goes into...
Sorry, doctor, can people go on mute, please, if you're not speaking? Thank you.
Once it progresses into periodontitis, the process is now irreversible. This slide just shows an example of simple gingivitis, where the swelling of the gums, you can see the redness and all. Improved cleaning, removing the hard stuff and all that would get this back to the normal stage. Next slide, please. Like I said, now early periodontitis, like I said, the gum recedes slightly, okay? You get little pockets form around the teeth and the gum. And this happens because you've lost bone. So the bone level drops and you can now get more things and more bacteria in there because the space between the gum and the tooth is increased and it causes further damage. Next slide, please. And this is just simple, the early stages. And you notice that there's recession, the bit of the gum that goes in between the two teeth is slowly receding. Unfortunately, a lot of this cannot be reversed. Next slide, please. So it progresses, if left untreated, it progresses into the moderate periodontal disease, like I said, and this is where you lose almost half the bone. Next slide. And further decay, and the gum has receded, the bone, you're now losing a lot more bone. Almost half the bone covering the roots has disappeared. Next slide, please. And then you now move into the advanced stage where, you've lost a lot of the supporting tissue, the gum, the bone, and the ligaments have been destroyed. And, this makes, next slide, please. And it makes eating and all that very difficult. And you notice that at this stage, you'll find out that, even teeth are now actually quite loose. But surprisingly, there are patients like this where you maintain them in this state, you can't reverse it, but the teeth are fine. So as long as there's no trauma or anything, even the little amount of bone that's left, even helps holds the teeth in place, and it's solid. Next slide, please. And this is just a rough idea of when we talk about what we see on the X-ray. If you look at if you start from your left, you see the bone that covers everything, and then as you move towards the right, you'll notice that the bone in between the two teeth, the second stage is flattened and you lose more. That is all part of the early bit. By the time you now go on to the moderate to advanced perio, you notice that you've lost a lot more bone. And next slide. Yeah. Okay, so like we said, what are the symptoms? What do you see? There's bleeding gum, there's bad breath, the changes in position of the teeth begin to drift and move about. The gums recede, it's red, it's tender, the gums are swollen up. There's buildup of tartar, plaque and tartar around the teeth. And once that hard stuff is on your teeth, you cannot remove it. It's the dentist that will do that, and invariably, if it's not treated, it results in tooth loss. And next slide, please. And what are the complications? Really, it's more like we said. If not treated, you'll end up, what happens is you end up losing bone and you end up losing teeth. Okay, the teeth will move and drift about as well. You can get abscesses, the gums will recede, exposing the roots. And once the roots are exposed, the teeth become a lot more sensitive. There's obviously pregnancy increases like I said, increased risk of complication during pregnancy, including low birth weight and preeclampsia. There's increased, like I said, increased risk of heart disease, pulmonary respiratory disease, and diabetes as well. Next slide, please. Treatment, like I said, is aimed to avoid the buildup of plaque and bacterial deposits on the teeth and gums. That's that hard stuff you're trying to prevent. Next slide, please. So, key thing is just simple brushing. I remember a South African lady who came to me and, simple brushing, before I go on to that, just simple brushing, flossing, brushing twice a day. And key thing is just cleaning all surfaces. 2 minutes, cleaning all surfaces. We'll keep and obviously the hard to reach areas in between the teeth, right? That's where your floss or interdental brushes come into play, and we'll get rid of that. Like I said, the electric brush toothbrush is obviously much better. And what you do is just put it on the surfaces of the teeth, and it does the work for you if you don't want to scrub. Because one of the things a lot of people do also is because they want to try and get a very good clean, they do it too hard, and that causes problems again. They traumatize their gums, and the gums recede because it's trying to get away from the bristles of the brush. So, and with the electric toothbrush, you avoid that. Says you should floss at least once a day. Usually I advise people after every meal, floss and whatever. Visit your dentist for a professional clean, especially when you've got that stuff built up. And usually, once if you can rub your tongue along the back surfaces of your lower teeth and it feels smooth, then you've got the buildup there. It should be rough. You should be able to feel each individual tooth. And obviously, don't smoke tobacco. There was a South African, next slide, please. There was a South African lady who came to me and said that I told her to stop smoking, and her reaction was that, what do you mean? My friend smokes 20 a day, and my friend's teeth are not like mine. I only smoke 5 and stuff. And she wouldn't listen. And as far as she was concerned, I didn't know what I was talking about. Anyway, I said, okay, I'll refer you to Guys for a second opinion. Anyway, she got to Guys. They told her to, because I told her to stop smoking, and she just thought I did, I had no clue what I was talking about. Anyway, she got to Guys. They told her she had to have 7 teeth out. And she came back to me, stopped smoking straight away, and started doing exactly everything I told her to do. Visual cleaning, like I said, once that hard stuff builds up on your teeth, once that, whether it's below or above the gum levels, you need professional help to get that up. And that's what your SMP or your surgical, at times they have to numb you up to do it if it's so deep, which is the root planing one. Next slide, please. If there's an acute infection, then antibiotics should be prescribed to bring that under control, because even apart from the damage they can do, they can also, apart from the chronic, just means a long-term damage they can cause, you can also end up with an abscess. And that's what, next slide, please. And that's where antibiotics come in. Follow-up appointments, we would say every 6 months. If your oral hygiene is good, at times they say we'll see you every 9 months or even yearly. If there's an acute, or people are prone to getting this, because there's some people, there's a condition that I didn't really talk about where it's called juvenile periodontitis. And what happens in that case is, no matter how good your cleaning is, some people are just carry the gene, and they will not, the disease will not stop until they lose every teeth in their mouth. It's just something cannot, it affects 0.9% of the Caucasian population, about 1.2 Asian, and I think it's about 2.9 of the Black. No matter how good your mouth is, the disease will just progress until every teeth in the patient's mouth. It's rare, but it's one of those that one does exist. Next slide, please. And we can refer you to the specialists who, where they are, they can raise a flap and do some things, clean the surfaces of the teeth and all that. Very rarely, once you've lost bone, it's very difficult to get that back. At times they do bone grafting, where they can get bone from other parts of the body to replace it, and hope that you can regenerate lost bone. At times, some people have braces to push the teeth back, to push the teeth down, so that it will encourage the bone to grow over it. There are things that have been tried that, results are very, results are not always very encouraging. And the key thing about it is, best thing is prevention. Next slide, please. And, the key thing about it is, like I said, is if it's caught early, you get the deposit early and you remove it, then long-term prognosis is good. The problem is, if we leave it there and it festers, then the more tissue that's damaged, the more difficult it is to clean. It progresses faster in smokers, and there are people who smoke 1 who have severe disease, and people who smoke 40 a day who would not show any degree of gum disease. We're all built up, all our genetic makeup is different, and we all react to these things differently. But general rule is, you smoke, chances are of one getting gum disease and it progresses. Next slide, please. And I guess that's where I'll stop. I hope it's been informative, and I haven't briefed through it too quickly, but thank you. Thank you all for listening. This is my first meeting. Thanks.
Thank you very much.